Hi, I'm Betsy Petrick, Executive Director of the UHS Foundation, and I'd like to tell you about an organization that does amazing work, the UHS Foundation. Every year we raise over $1 million to provide needed medical equipment and program enhancements. Whether through fundraising efforts, through special events, grants writing, major gifts, we touch the lives of thousands. In fact, we've probably touched the lives of your family members, neighbors, maybe even you. See, UHS is a not-for-profit organization, just like United Way, the Boy Scouts, the Food Bank. But while healthcare costs have dramatically risen over the past few years, reimbursements declined, and that leaves a fairly large gap. It's a gap that our donors try to fill. We're working towards filling it with money that sometimes comes in $1 at a time, and it is so vitally important to our community. Let me introduce you to 3 people who will briefly tell you how in the real world the UHS Foundation has improved healthcare. First, Karen Fabian, Nurse Manager of the Neonatal Intensive Care Unit, affectionately known as the NICU at UHS Wilson Medical Center.
Here in the NICU, we care for the smallest infants in the area. We care for anybody from 26 weeks on up, so that can be anywhere from 1.5 pounds up to full-term infants. The foundation here at UHS has been a major contributor to our unit. They gave us not just equipment, not just financial support, but really what they gave us was a wonderful start for all these babies. The money from the foundation can fund numerous projects within the NICU. Yes, we have larger things such as a transporter and different things, but we also have small things like beanie babies that we use for positioning. Some of the babies aren't much bigger than a beanie baby, and we use that for that reason. They've given us rocking chairs, they've given us positioning aids, mattresses, different things like that that we really need for the babies that we just can't go out and buy on our own. The foundation gave to us about $2 million to fund this project for our new NICU, and it was just amazing the day that we opened up. We were so excited, and the foundation was here to help with the ribbon cutting, and we were giving tours of the new unit. We were so proud of it and so excited. One of the founders brought his grandson along, and we gave him a tour, and he was so adorable. He looked up at his grandfather and he said, "Grandpa, is this the unit that you built?" And his grandfather looked down at him and he said, "Yeah, it is the unit I built." And it's so true. The foundation and the community and the donors, they're the ones who built this NICU.
My husband and I have been blessed with triplets, and our community is blessed with the UHS NICU. I can't imagine what we'd have done without the NICU. The care our children received was amazing. The nurses on that unit are all angels, and the people who donated to create the expanded unit will forever have my family's thanks.
Sue Cost, Breast Center Program Manager here at UHS Wilson Medical Center, tells how even small donations can make a big difference in the care we provide.
I'm Susan Cost. I'm the Program Manager of the Breast Center, but I'm also a registered nurse who works in the Breast Center. We help women with their mammograms, ultrasounds, getting their results, working with their physicians, helping them get answers they so desperately need. And the good news is we do give a lot of good answers. We do post-op visits on every woman who has had a mastectomy. And what we began to realize that women didn't know what to wear when they got home while they were still healing. We found a wonderful, soft, comfortable camisole for women to wear, but we didn't have any money to purchase them. We went to the foundation. And I'm happy to say every woman who is discharged from United Health Services goes home with a soft camisole to wear after her mastectomy, so she feels feminine again. And having this soft camisole is comfortable. It buys them the time before they need to go and purchase a prosthesis. So it's a nice way of giving women a kind of a hug from the foundation.
After my mastectomy, I was so afraid I would never look or feel feminine again. But just before being discharged from the hospital, I received a gift from the foundation, a beautiful, soft, lacy camisole designed for mastectomy patients. I put it on and cried. My healing officially began at that moment.
And finally, Prakash Ramanathan, Special Projects Director here at UHS Hospitals, tells of 2 very large projects the foundation contributed to.
Part of my job involves the planning and execution of renovation or new construction for clinical care programs, and that's how I've gotten to know the work of the foundation. What I'd like to do is talk to you about two major projects that the Foundation has supported, and those are the UHS Pre-Admission Testing Center and the UHS ICU at Wilson Medical Center. UHS Wilson Medical Center is the region's only trauma center. That means that we care for the region's most critically ill and injured patients. Recall some of the tragedies that our region has endured, such as the BU scaffolding accident, the shooting at the American Civic Association, and the Route 81 Department of Transportation workers accident. Many of those patients were cared for at Wilson Medical Center, specifically in the Wilson ICU. Those critically ill patients spent weeks and months in the intensive care unit. That care is very expensive and requires lots of resources, and that's where the Foundation has supported us. Another example of the Foundation support is with the UHS Pre-Admission Testing Program. Now that's a showstopper of a program. It offers our surgical patients one-stop shopping for all of their pre-admission tests. The Foundation's support of $800,000 allowed us to purchase all of the state-of-the-art digital diagnostic testing equipment in the pre-admission testing program. That $800,000 was not the result of one or two large donations. It was hundreds, no thousands, of small donations, and every single one of them counts.
On June 2nd, my son called to let me know the scaffolding he and his crew were working on at Binghamton University had collapsed, sending 5 men tumbling 5 stories to the ground. My son was standing on the platform that did not fall, but my nephew and 2 close friends were severely injured. I truly believe that had it not been for the first responders on the scene, the emergency room staff, exceptional doctors, and the subsequent care, that these men would not be alive. Without Wilson's staff and many prayers, this letter would have a different outcome.
When you think of a hospital, you naturally think of doctors, nurses, lab techs, aides, housekeepers, and food service workers. But there's another very important member of the care team: donors, people who give to the Foundation. We rely upon their support, and we ask for money from people like you. In fact, people just like you. So if you can help, it would be great, really great. Your money will touch the lives of the thousands who come to UHS for care and comfort. Your generosity will benefit many, and on their behalf, thank you.